In a healthy person, cells grow, divide, and die in a controlled way. Cancer is developed through the uncontrolled mitosis or division of mutated cells. Mutation impacts upon the genetic encoding of one's DNA, which is located within the cell's nucleus. The mutation occurring in lung cancer is initiated by voluntary or involuntary exposure to carcinogens and is influenced by one's genetic susceptibility. This results in the growth and division of unwanted cancerous cells, which forms a tumour or mass in the airway or pulmonary tissue. The carcinogenesis of lung cancer begins in either neuroendocrine cells, which lead to small cell lung cancer, or epithelial cells, which lead to the most common form, non-small cell lung cancer. This type can be further divided into three subtypes: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. The leading risk factor for the development of lung cancer is the exposure and inhalation of tobacco smoke, with further risk factors including the exposure to asbestos, environmental toxins, radiation therapy, air pollution, and more. Lucy firstly presented with the outward signs and symptoms of a cough, hemoptysis, dyspnea, and chest pain. These signs and symptoms are dependent on the positioning and type of tumour. Unfortunately, the clinical manifestations of lung cancer are often only outwardly presented when the disease has reached an advanced stage. The mere presence of a carcinoma, which occupies space within the central airway, is largely responsible for a cough within lung cancer patients. The growth of a tumour within the endobronchial region of the airway stimulates mechanoreceptors, which initiate a cough reflex. Hemoptysis occurs in response to ruptured blood vessels within the respiratory tract. Lung cancer patients experience tumour-induced angiogenesis, which increases blood flow to the tumour site and results in hypervascularity. The blood vessels produced through angiogenesis are of a leaky and tortuous nature and are easily eroded through the growth of the carcinoma itself, or commonly rupture when mechanoreceptors are stimulated and produce a cough. A tumour located within the central airway causes partial obstruction and minimises the space through which air can travel. This results in a smaller airway lumen, which causes dyspnea and increases the labour required for ventilation. Chest pain experienced by lung cancer patients most commonly occurs on the side of the chest correlating with the primary tumour. Chest pain caused directly by lung cancer is due to the tumour invading the pleura or chest wall through growth or metastasis. Extension of the primary tumour into the pleural space or the metastasis of the tumour can cause pleuritic pain through pleural effusion or thickening of the visceral or parietal layer.